Good morning and welcome to the Oscar webinar. Thank you so much for your attendance. Much appreciate all the early attendees as well, and thank you for your patience waiting for as many as people as possible to join on. So this is our second portal training that we've had. We had one earlier on Monday as well. This will be recorded as well. Slight differences, we'll go through some specific step-by-step process on the enrollment portion of this as well. So again, we'll go through just a quick update on Oscar itself, our national footprint, registering for the EDE, so making sure we do that through the broker portal, and briefly on quoting, also renewing your members, and then just a brief word on troubleshooting at the end. We'll have some Q&A at the end. We have a number of attendees, so we might not be able to get to all the questions, but happy to also follow up via email afterwards as well. I'll be presenting today. My name is Jared Wasley. I'm a sales lead here at Oscar, and I'm helping to present just this EDE portion as well. We'll also have the contacts of my colleagues who represent the various states as well. So if you have any state-specific questions and need assistance there, we will also have that information at the end of the presentation. So as a reminder, Oscar's mission has remained really unchanged since our original founding in 2012. We want to make a healthier life accessible and affordable for all. We also mean that in the sense that we want brokers to access what this full suite of what Oscar has to offer, and that's also why we're going through this presentation too. As a snapshot, we have 1.6 million members across 18 states, over 500 counties. In actual fact, 1 in 14 individuals on the ACA has an Oscar policy. So really proud of that metric, proud of the growth, and we thank everyone on this call for being a part of that story and a part of that continued growth that we've been able to experience over the last few years. So let's go straight into it. How do I register for the EDE? How does this process start? And that EDE, of course, is through our portal. Well, first and foremost, we'll start with the assumption you already have your broker portal, since that's where you go and get your appointments. And so just make sure that you're appointed in each state before selling any policies. And from there, we're able to enroll members in Oscar plans directly into the exchange. So the first setup is to go to our individual book. So that's where we'll first click on the top right, and then we'll select new policy. Or if we have yet to register our EDE process, again, this is separate to the appointment process, we also will see a banner as well that says it looks like your account has not been verified. You can also use that click here function as well to complete this first part of this process. Then it will say, hi, let's get you set up. We're going to confirm your contact information. We'll verify your identity through Experian, and then finally linking that CMS account to ensure that we can enroll clients through healthcare.gov, Georgia Access as well. So the first screen you'll see there is you need to select the exchanges that you are certified with. So everyone will have to select healthcare.gov, of course. And if you sell policies in Georgia, they require a separate certification process. Make sure you select Georgia Access as well. Thereafter, we'll give you a moment to review your contact information and your NPN. So make sure that we're spot checking this, even double checking that that NPN number is correct. If there are any issues with this, the broker support team will be able to change those for you and help you with that. And then that takes us to the fourth and final step, where it will say we need to link our CMS account. So again, CMS requires that all agents and brokers verify their identity with Experian, and so just enter the information as it would appear on your most recent credit report. It will go through a number of identity proofing questions as well, and thereafter you'll see the CMS link pop up. And with the CMS link, you'll use the same login that you would have used to complete your marketplace certification for the current plan year. Once that's done, you are registered as a broker to utilize the EDE. As a reminder, all platforms, ours included, you have to complete this final step, that linking of the CMS account, every 12 hours. So let's say, for example, you've completed all your enrollments today, you log on tomorrow morning at 11 a.m. You will then need to re-link that CMS account and then automatically you'll be added. You don't have to go through the full registration, but just as a reminder, all agents have to complete this every 12 steps, every 12 hours, apologies. So now you're set up. How do we renew our existing book? How do we go about doing that with our book of business and managing renewals first and foremost? Well, firstly, let's take a look at what the individual book of business looks like. So this is the current view we have right now. We have new functionality. So we have this dashboard view where you can see overdue payments, the percentage of members that have autopay turned off as a percentage, and then also want to focus on those at-risk renewals. So those renewals are now live, of course, and this will point to where the members have had a premium change. They will be flagged as an at-risk renewal, or if there's a copay adjustment that will impact them. I also would really encourage all brokers, before you do any enrollments or any of your renewals, export the CSV. On the right-hand side there, you see that export CSV file. That'll download your full book of business for active and inactive policies, and will give you a really good snapshot into the auto map policies for your members and which state they're in, which plans they've chosen, etc. And it's a really good way to be able to spot check your renewal book. So once we're ready to renew, we will select the member that's appropriate. Let's say it's the first one on our list. Again, we recommend going towards those at-risk renewals first to take care of those members. You would come to the screen that you see here. It sometimes will default to the member info page. All you have to do is select on the renewals tab that you see there. So renewals tab will give you the current plan that you see in the column there, 2024 plan. The 2025 plan will auto-populate with the auto-mapped option. So important, again, going through that process, we log into the broker portal. We've already completed that registration, right? We select the individual book. We select the specific client, preferably those at-risk renewals. And then we're able to see this renewal screen. If a client is renewing to the same plan, so let's say there isn't an income change, they're happy with the auto mapping in this case here, there is nothing required further. There's no action required. Those members will be auto mapped automatically and they'll show up in 1-1 in those plans. If a member has an income adjustment or they want to choose a different plan perhaps, you will then select the button that you see there, Explore Other Plans. So let's go through a demo of what this would actually look like. So I'll have to change screens here, so just give me a moment to adjust this. So once we've gone into those selecting other plans, you'll come to this screen here. This is the Stride Oscar EDE portion. This is the EDE portion of our platform. So think of this as a secondary menu, essentially. So the first thing that we'll do, let's just start a quote to go through that process to see. So we'll select Start Quote. This is starting from the beginning of an enrollment. We will click the zip code, we'll add date of birth, and then we will add income. So for renewals, and of course for new business, the income will not carry over. You must add the income for all policies if you are going through these steps. So we add the amount, and we follow the process accordingly. We double check the income, it'll calculate the subsidies now. We've seen the subsidy, what that calculation looks like, and then we'll look into plan results. And now we are able to look at on exchange plans. If we are looking at off exchange, you'll see in the top right, you can toggle for off exchange. It's not fully applicable for everybody, but we have had those questions pop up a few times. But we're just looking at off exchange right now. So we have this whole plan year. This will be for 2025, of course. We're looking at the zip code 43004, income of 40,000. And now we want to select the plans that we think are most appropriate, and we will compare them. So let's select a few plans to compare. So we've selected 3. We've selected a Bronze Classic PCP Saver, the Silver Simple, and a Gold Classic. So let's click on Compare since we're showing our client this. Now you'll look at a very familiar screen. It'll give us all of these implements in terms of the premium, deductible, max out of pocket, and go through the various cost shares. Let's say we want to share this with the client or email it to them. I will then go to the top right, select print. I can save this as a PDF. And then I'm able to save that and send it via an email. I can also look at pre-deductible benefits that we're seeing right now, and I can see post-deductible as well. And finally, if we want to save this lead, it'll actually save the quote that we ran. We'll save the client in this case, click continue, and we can also continue to enroll them as well. So here it says, let's get started. This should take 10 to 15 minutes. Again, this is for somebody new. So that was just the quoting portion. We're actually now going to go into an enrollment portion for this member. So again, we've already saved the details, right? So all those details are saved, the member's name, the DOB, zip code, the state. We will go through a number of attestations to make sure that I confirm I'm working with this consumer, that I have consent for this from this consumer, and that I have documented that consent as well. Very, very important step for this year. I'm sure we will all agree. And then we'll go into starting a new application. Just tells us a step-by-step of what we'll do. Again, questions about the household, those demographic questions, downloading the eligibility results, and then processing it through the marketplace. Number of disclaimers again, making sure that the data is, again, consent for those folks listed on the application, require that the answers provided are true, and then authorizing Oscar to work as the broker, and that's essentially consent to file this application on behalf of the member and the broker. Important point for this year, active renewals and new business needs to have an SSN. So previously, this could kind of be skipped over to a certain extent. Now, even with active renewals, so these are folks who maybe aren't auto-mapped or have to select a 2025 plan, and for any new renewals, in any new business, SSNs have to be selected. So we go through this process as well. Other demographic information too, which is optional. And then how would we like to get notices about the application? We tend to specify email here for better record keeping. We'll select the address, of course, go through that full process. And then now we can gather information on the income for the member. So we'll select the single, whether they're dependents, very similar steps to what you see on other platforms as well. So you see, has to go through all these demographic selections and questions. We'll of course select them for each client, and then we essentially are completed with the income estimate for this client, which was in 2024. This is also another step, professional helping your application. This is in regards to a navigator or counselor helping it. So optional again, but for brokers, that would not be applicable either. We then want to go into any QLEs if this is the applicable option there. And again, another attestation that the consumer is reviewed and confirm the accuracy of the information. Also another reason why we offer that PDF so that you can save that and send that to members as well. So now again, it'll give us an option to save this once more with the eligibility results. It'll give us an application ID number of that as well. And then we select, we're confirming the options here. We can take a look at the plan, Silver Simple Select. what their subsidy, what their premium amount is, the start plan. In this case, as I mentioned, this is an SEP. That's why those SEP questions come up as well. And then the pre-deductible costs that are involved in this plan. Finally, we have to sign to enroll the plan. So we understand that the premium tax credit will be paid on my behalf to reduce the cost, and then other attestations as well. We'll sign and submit. And then, because of the QLE, it requires the SEP documents. In this case, of course, not applicable for the open enrollment process. Again, if this is an SEP, it will highlight that the documents are required and the timeline that we have to do so. We're actually able to upload these documents if need be through this dashboard too. So that's the full tutorial in regard to getting somebody enrolled. Very similar process as well for the renewal processes for folks who are exploring other pages or other plans and also have a premium adjustment. So let's go into troubleshooting. Let's say, I've gone through the registration process like Jared showed. I have my FFM number is working, everything is good there. What are some of the common troubleshooting items that we might see? Well, the first thing is that we might see that this notification of your account not being verified yet. Essentially, all that is we have to go in and complete that broker registration like we showed. So we have to log into the broker portal. We have to make sure that the FFM and our FFM number and certification is properly linked to the account. So we'll have to go through that process. So if that's done, fairly straightforward, you are all set up to start enrolling. Finally, the other thing that we see a little bit of is that of FFM or FFE ID errors. So you might have multiple IDs in one portal. Perhaps you have an agency NPN that you're using and you have a personal as well. There might be a mismatch there. The easiest option there we ask for brokers is to submit a request on the portal. So if you see on the top right of the broker portal, there is the menu hamburger icon that will shift this page over and you'll see this full menu open up. Then go to the bottom under need help, you will see report an issue and this broker support request will go in. This is a lot faster than emailing the request over, and because it's already linked to your account, it'll automatically open a ticket as well. So you submit that information, add the issue that you're having. More than likely this will be, in this case, the FFE or FFM issue, and that'll be a quoting or enrollment portal access issue. And our team has been working tirelessly for any of these requests that have come in, and they've had really quick turnaround times as well. So I really ask that folks utilize this tool for any issues that they're getting after creating that registration. So again, you have to go through that registration process, but if after that you're still encountering an issue, please make sure that you submit a ticket on the portal. Finally, overall, you have a number of tools as well. You have the broker support team overall, so brokers@hioscar.com. You can also utilize the 855 number for any time-sensitive matters. We also have the broker resource page, so please make sure that you're utilizing that as well, hioscar.com/brokers. Here you'll see the plan grids, network one pages as well for all of our networks as well. And of course, you have the regional sales team as well, someone like myself or my colleagues who can help you with local market-specific questions that you might have around selling. Ultimately, we want to grow with you. We want to keep growing together, and we really appreciate everyone's sort of patience as we move towards this new platform and getting used to this new tooling as well. We believe we offer fantastic broker support. I'm sure many of you work with my colleagues around that as well. Our broker tooling, although new for many of us, really is fantastic in terms of the functionality that it has. And we already have a continued investment in the IFP products that we have on the ACA. We've been in the ACA for over 10 years, so we have a decade of experience doing this. We really care about our customers, about our members, our brokers, the full suite of everyone that interacts and works with OSCA. And so again, we thank everyone for their time. If there's something that I didn't cover in this or that you have specific questions of, please feel free to contact me directly for any of the states listed under my account there. Just generally, that's Georgia, Tennessee, Ohio, North Carolina for the most part. And then if you have specific Texas or Florida questions, please reach out to the appropriate colleague as well. I'll keep this contact page up just for a little bit longer, but what we will go through is to a live Q&A. So if you're watching the recorded portion of it, that will be the end of the recorded portion, and please feel free to email us any questions. Again, thank you so much for your time. Thank you for attending. We hope that this was helpful, and we'll go to some Q&A.